Supervisor Barrios.
Okay. Ready, salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Would entertain a motion of certificate?
So moved.
Second.
All those in favor?
Aye.
Aye. Passes 5-0. We will move on to presentations and recognitions. Would someone like to adopt all three of the resolutions?
Move to approve all of those resolutions and proclamations, Mr. Chair.
All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. We will have the first one, which is the proclamation for Assault Awareness Month. Is there someone here to receive that proclamation? If you want to come to the podium.
Hey, how are you? Good to see you. Okay, so the first resolution here is a proclamation for Sexual Assault Awareness Month. And I'll just read the last section because it's 2 pages. And so our board reaffirms its commitment to address the issues of rape and sexual assault and speaks out against sexual violence by remembering victims and survivors, holding the perpetrators responsible for committing sexual attacks and challenging the societal myths and behaviors that perpetrate sexual violence in our community, and designates the month of April 2014 to be Sexual Assault Awareness Month in San Benito County. So we certainly thank you. You're more than welcome to say a few words if you'd like.
Thank you. Thank you very much. So my name is Eric Elliott. I'm from Community Solutions, and we're a nonprofit here in San Benito County. And I'd like to thank the board for recognizing April as Sexual Assault Awareness Month. As a community, it's important that we raise awareness around this issue because unfortunately sexual assault happens more frequently than I think a lot of people would like to admit. Statistically, 1 in 4 girls and 1 in 4 boys, or 1 in 6 boys under the age of 18 will be sexually assaulted, and 1 in 3 women in their lifetime will be raped around the world. So it's an issue that is important to make sure that we consistently address and try to prevent and raise awareness around. As Community Solutions, we here in San Benito County provide support to sexual assault survivors through peer counseling, legal advocacy, and community awareness. One of the events that we're doing is the Walk a Mile in Our Shoes, which will be this weekend on April 5th on Saturday, so we're really excited to partner with the Mayor's House for that. And hopefully as a community, like I said, we're continuing to raise awareness to put an end to sexual assault. Thank you so much.
And our next proclamation is our next proclamation is the Walk a Mile in Her Shoe Day. Supervisor Barrios?
Yes. Thank you so much for everything that you do.
Thank you.
And the awareness. Proclamation Walk a Mile in Her Shoes. Whereas Walk a Mile in Her Shoes Day is intended to draw attention to the fact that rape, sexual assault, and intimate partner abuse remain serious issues in our society. And I'm going to read 2 of these because I think it's very important for the awareness. Whereas no one person, organization, agency, or community can eliminate rape, sexual assault, or intimate partner abuse on their own. We must work together to educate our entire population about what can be done to prevent rape, sexual assault, and intimate partner abuse, support survivors and their significant others. Whereas Walk a Mile in Her Shoes expands the dialogue between men and women on gender differences, gender relationships, and gender violence, and for men to also publicly demonstrate their courage and commitment to preventing gender abuse and violence. Now, therefore, be it resolved that the San Benito County Board of Supervisors designates April 5th, 2014 as Walk a Mile in Her Shoes Day in San Benito County. And I challenge all the men in our county to support this and to show up, bring your shoes. It's amazing what you can do in just one day for awareness and education. So thank you. Thank you for everything that you do for our community.
Thank you. Last year, we were really honored to partner with the Mayor's House, and this year again, we're partnering with the Mayor's House from San Benito County to present a Walk a Mile in Our Shoes, which was, last year was our first annual. We had over 100 participants in the walk itself, and a great involvement from the community to come out, especially for the first time ever doing that event. And so we're really excited this year to do it again. Hopefully the rain will go away by Saturday, because that's what we're hoping for, and hopefully we'll have a lot more community members to come out this year. And once again, we're really excited to partner with the Mayor's House to bring attention to intimate partner abuse and sexual assault, and to raise awareness around how, as a community, each and every one of our members can make a difference by just standing up and saying it's not okay. It's the biggest thing that every member can do in our community. It's a simple, simple task, but when you see something that's not okay, just say it. Thank you very much for all of your guys' support, and we really appreciate it.
Thank you.
Thank you.
Thank you.
And our last proclamation is the Public Health Week in San Benito County. Supervisor De La Cruz.
Sam? How are you? How are you guys? It takes great pride to make the next announcement. I, as a kidney transplant myself, a patient myself, a transplant, I know that in my early days, education was very important to our health. Knowing the unknowns were very important to a lot of members of our community. And it's proud that on April 7th to 13, 2014, will be National Public Health Week in the United States, and the theme Public Health starts here. That is so true. It's about us. It's about us educating ourselves, about us knowing what to do, knowing that if there's an individual who looks sick, make preparations for yourself to ensure that you don't get sick, and the illness and the sickness doesn't go to other members of the community. Whereas since 1995, the American Public Health Association, through its sponsorship of National Public Health Week, has educated the public, policymakers, public health professionals about issues important to improving public health. And 7 in 10 deaths in the United States are related to preventable diseases such as obesity, diabetics, high blood pressure, and that was one of the conditions that I lost my kidney through high blood pressure, and cancer. And 75% of our health dollars are spent treating such as these diseases. However, only 3% of our healthcare dollars go towards prevention. And I think that's very important. I think it should be the other way around too. We need to educate the public in order to minimize that expense from the other side of the coin. Whereas now, therefore, be it resolved that the San Benito County Board of Supervisors do hereby proclaim the week of April 7th, 13, 2014 as Public Health Week in San Benito County. Co-workers and leaders and called upon all residents to observe the week by helping families, neighbors, friends, co-workers, and leaders to better understand the value of public health and adopt a preventive lifestyle habits in the light of this year's theme. Public health, start here. Thank you.
Thank you.
You're welcome.
Thank you, Jaime, fellow Board of Supervisors. I just wanted to mention again that this is Public Health Week, and our message this year is that public health starts here, meaning it starts locally. And I would like to have everyone consider taking an oath maybe to do something during that week, next week, that will better their health. Either it's eating off of a smaller plate for portion control size, taking the stairs as opposed to the elevator, walking, maybe getting to sleep 30 minutes earlier than usual. And a few things that we're doing in public health during that week is we're going to be going on KMPG and doing nutritional education presentations. We're also going to be in front of Hollister Super and other stores throughout the community doing food samplings of healthy foods. I mean, we do live in the salad bowl area of the world, and it's amazing how many kids will go and get a bag of chips over a fresh salad. So another thing that we're doing on Tuesday is we're actually conducting an emergency preparedness summit for organizations that provide services to those with special needs. And many of the board here have been at some of our summits that we've had. Thank you very much. And so this will be this coming Tuesday, and please stop by if you don't have anything else to do. And I just want to let you know that, as we all know, health is such a crucial role in everything that we do. Without good health, nothing else seems to matter. So thank you very much for acknowledging us today.
Thank you. With that, we'll move on to public comment. This is an opportunity to address the board on items of interest not appearing on the agenda, and we'll limit the speakers to 3 minutes. Do we have any speakers?
Marvin Jones.
Thank you, Mr. Chairman, board members. The United Nations, IPCC, whatever that stands for, climate control, had their report recently where, just in the last 2 weeks, where the world is going to be flooded. And our Secretary of State said that the climate change, global warming, whatever you call it this week, is the most national security issue we have. What about Crimea? What about the Middle East? What about the Korean Peninsula, which is heating up? South America is having its problems. Gave you a graph there, and if you look on the side that says Northern Hemisphere sea ice, I see ice coverage since back in the 70s. They've been measuring the sea ice year-round. The yellow line there coming from the left is current as of yesterday. It looks like about 4 weeks ago, about the time that airplane got lost in the Indian Ocean, there was a big jump in the amount of sea ice holding up there. It's almost up to the average for the last 40 years. If you look on the other side, you got the Southern Hemisphere sea ice. Last summer there was a report of some vessel in the Southern Hemisphere that was going down to measure all the ice that's gone. If you look there at the yellow line, it's at an all-time high. So the ice isn't melting. It may tomorrow, but it's not today. It didn't yesterday. I don't know where our Secretary of State's coming from. It just doesn't compute. Smoke and mirrors. I don't know what he's trying to cover up. If I may have, 30 seconds left? A minute 3. Oh, well then, new topic. I had a conflict when you had your meeting, 2 weeks ago about the general plan. I understand there was a conflict on which version of the general plan you were discussing, that's okay, that happens. Is there any way that the public can have access on your internet, for example, of the latest version of the county general plan dated April 2014? We've got the old version, we've got several versions in the middle. There have been some changes, and as I mentioned, even there was some confusion at your meeting a couple of weeks ago on which one is the latest. Is there any way we could get that on the internet so we could look at it? There's some things in there that just aren't compatible with the Constitution. You folks took it. Okay. See you next meeting.
Thank you, Doctor.
Erica Andrade.
We knew which one.
Good morning. My name is Erica Andrade, and I am here to ask a raise in our wages. I'm currently taking care of an elderly, and I take care of her 7 days a week. And this elderly cannot go prepare her meals by herself and do her own things by herself. And there even is a relative. There's nobody else in the house that can do it for her. So I am taking care of her, but the money that I am making is not enough. So I'm unfortunately thinking that if I don't get more hours or increase my salary, I will have to look for another job. But it's going to be hard because no one can cover the time that I am helping this lady, and at the end, they will have to look for a house for her. And I know that probably, like me, well, I know for sure that all these people that is here, they are trying to get a raise too because they have the same problem than me. So that I am in right now in a position where I feel bad about it, but I want to help family member and stay as much as she can stay with us and the family, but to the point that when I cannot anymore to afford to take care of her and nobody else can do it, she will have to go a house. So I hope that you consider that and help us with this request. So that's all I have to say for now. Thank you.
Misha Sharon Jones.
Mirsha Sharon Mondragon. Mirsha. I'll be translating for Mirsha.
Honorables señores, muy buenos días. Estamos pidiendo de todos ustedes el apoyo y la comprensión. Nosotros somos un grupo que cuidamos enfermos en casa. Nuestros enfermos son ciudadanos americanos, son personas que necesitan respeto y con derecho. Nosotros necesitamos un aumento en nuestro salario. Lo que nos pagan no es suficiente para cubrir todas nuestras necesidades. Estamos en un país de la gran abundancia, mas sin embargo a nosotros nos tienen en la miseria. Por eso les exigimos a ustedes, honorables señores, su ayuda y su comprensión.
We're here asking you for your support and for your understanding for the need for home care workers for a better wage. We are people that care for the elderly. They have rights and they have necessities that are too much to make ends meet with their current salaries. With how we are paid, with the amount that we are paid, we cannot meet all of our necessities. We are in a world and we are in a country where there's abundance of resources. But we are treated with this misery to continue our lives in this way. We ask for your assistance and for your help.
Muchísimas gracias por escucharme.
Thank you for listening.
Lynn Martinez.
Hello, my name is Belen Martinez, and I take care of my daughter who has cerebral palsy. My daughter needs 24-hour care, and I've been taking care of her for 27 years. I'm here to support all the home caregivers. We need a raise to make a living. We can't make a living with what I in home care service space. We can't make a living. Right now, only me and my daughter live in the house. I can afford to buy insurance for myself, but I'm getting paid. I don't get paid 24 hours. I don't get paid 24 hours. My daughter needs are very, she cannot do nothing for herself. I have to do diaper change, feed her, grind her food. She cannot see, she cannot speak, she cannot walk. I have to do everything for her. So when I'm not at home, I need somebody else to be with her. It's really hard. It's every day, every day. I'm living one day at a time, with my daughter, and I can not hire somebody else because my daughter is heavy. She weighs 112 pounds. Nobody's going to take care of her with what in home care service space. It's hard to find somebody and somebody to feed her and everything. You know, she needs, you know, a lot of care. Okay, she's 27 years old. Without me taking care of her, I don't think she will be with us anymore. So at this point, I'm thinking of putting her in a home because I can afford a living with the income in home care service space. I can afford an insurance. We can make a living out of that. I have to hire somebody else to help me too, but it's hard to find somebody else. So please support us because all these people, they need as much as I do. Thank you.
Lupe Salcido.
Good morning. My name is Lupe Salcido, and thank you for having us. I, too, am a caregiver, and I come to speak mainly for the elderly and the handicapped because I work taking care of my mother, and I think that it is so important that these people live with dignity and respect. And we need a raise to help us get through, and we need to keep them home where they are comfortable, where they feel that they're in their own environment. And I urge you to consider a raise for this caregiving program. Thank you.
Salo Diaz.
Good morning, ladies and gentlemen. My name is Sally Diaz, and I am a care provider and a member of the United Long-Term Care Worker. I am here to speak on behalf of all our members as one voice, our voice. First, we are concerned about our benefits. We want to be able to pick our physicians and our own dentists because we know what's best for our loved ones. Secondly, I have to say our hours are part-time for elderly and disabled. They need so much care and assistance. Us care providers are the ones that bathe them, change their clothes, give them their medication, cook for them. We clean their house, go grocery shopping, drive them to run errands and doctor's appointments, and we do not get paid for mileage or gas. Some of us have to read the client's mail because some disabled are blind and the elderly cannot see well. So what I am asking for more hours instead of part-time hours. It should be full-time. Our last concern is our wages. We deserve a higher pay than what we are receiving. It is hard work. Some of our clients have to be lifted on a daily basis, either to move them or bathe them. I almost feel sometimes like Cesar Chavez must have felt at one point. We work so hard to care for the elderly and the disabled that they need so much assistance at all times. But the state wants to remove our benefits, and I am here to say it's wrong. Again, we don't have enough hours and not enough pay. We are one voice. We are care providers. We are United Long-Term Workers.
David Werlin.
Good morning, Chairman Munzer, members of the board. My name is David Werlin. I'm the Regional Director for SEIU United Long-Term Care Workers. I have the privilege of working for these folks in the back. These folks have done their part. They do their job. They do their job every day. They've done their job for this county. It's interesting. You have designated next week as Public Health Week for this county. That's fantastic. It would be a great opportunity to actually take care of some of the most important public health workers in this county, which is the 370 some odd home care workers who care for the seniors and the disabled. Again, they've done their job. They went to Sacramento year after year. They went to Sacramento and they assisted in freezing the costs for this county. So over the past 3 years, the costs for this county for IHSS have been frozen. That's the work of this group. They went to Sacramento and to the federal government, and they lowered the costs. We brought in over $71,000 each year over the past 3 years to this county, which you've not used to benefit this program. It's time for you to do your job. They do their job every day, bathing, feeding, bathrooming, cleaning, cooking, doing the work needed to allow the people of this county, the seniors and the disabled, to live lives of dignity, to live lives of independence. And they do that work day after day. They're the lowest paid in the Central Coast for doing that work. In this county, they make $10.50 an hour, generally part-time hours. Any other county in the Central Coast, they would be making in Santa Cruz, they're making $11.90. In Monterey, they're making $11.50. In Santa Clara, they're making over $12.20. It's time for this county to move up. It's time for this county to, this Board of Supervisors, to do your part, to share in the benefits that these workers have brought to this county, to share it with these workers, to give these workers a raise. We've been working with this county for over a year to try and bring that money to the table, and the county has refused. It's time to take care of the people who take care of the seniors and the disabled in this county. Thank you.
Is there anybody else that would like to address the board at this time? If you want to come forward.
Good morning. My name is Uriel de Avila. I'm here for a purpose to get help from you guys. And I have not too much to say, but I have a kid. You know, he's working. He's in high school and he already has a work, and he's serving ice cream, which I'm happy with that. And the thing is, he's kind of bringing the same wages I'm bringing home. He's doing the same thing, and I don't think nothing wrong with serving ice cream. But I think there's nothing better to taking care of people, older people. They're handicapped, and also I have a friend. Also, he's a bartender. He's making $15 an hour. Of course, I'm not going to be a bartender, but I think I want to keep helping my dad and people that need us. So if it's in your hands, please, to give the little tip, the little help to us, it'll be, thank you to you guys. If it's in your hands, thank you.
Okay, one last time. Is there anybody else that would like to address the board at this time? Seeing none, we'll move on to department head announcement. Mr. Espinoza.
Thank you, Mr. Chair. Yeah, there are a few announcements this morning from department heads. We have one correction on item number 3. Apparently, during the scanning process for the minutes, page 11 got missed. So we wanted to go ahead and let the board know that you have copies of that page 11 on your desk as well as in your mailbox, and we have copies in the back as well for the public. The other item number 2 on my list, is next week, April 8th, we have a special board meeting that's going to be discussing with your board addressing the budget and finances. We'll be reviewing with your board different things concerning personnel, equipment, infrastructure, and also too looking at critiquing last year's budget process. So we're going to go ahead and review that with you. Timelines, as well as a financial status report. We'll be looking at also a 3 to 5 year plan, a forecast with your board, and other miscellaneous items. So look forward to that next week. Again, that's going to be April the 8th at 9 o'clock in the morning. At our last board meeting, An item came up with regards to Buena Vista and West Side Street. There was some street racing that was been occurring, so we met with the city. County staff met with the city, and there's going to be an increase of police department, sheriff, and CHP patrol from now on in that area. I just want to make sure that the board was aware of that. This county staff also met with the city and LAFCO executive director last week to discuss the sphere of influence and annexation fees. So we'll be coming back to your board in the near future with that as well. Just wanted to give you an update with that. We have been working on our ERP project. Our auditing department as well as administration have been working a lot on that. And Joe Paul Gonzalez will be sharing with your board just a quick brief of what we've done over the last, well, it's been a lot, 3 years or so we've been working on this. But we'd like to invite Joe Paul up to the podium.
Good morning, Chair, Board of Supervisors. Some of the board members have actually been by the board conference room where we've adopted that as our area where we, get together with New World Systems representatives and Wildam representatives that are the consultants that help us with this project, and has seen firsthand what we're doing. Up on the screen here is a kind of a shot of the work that we have done thus far in the setup of the actual setup of the funds, GL strings, which are funds, departments, divisions, and we call them PSAs, which are programs or activities. So the level of definition of which we are converting from our old BITEC system over to the new system is going to be a lot more management information available in the ERP system. Here we have a GL account where this is the revenue type account. Let me move out of here. This is kind of this list is our list of departments. Right now, currently, the Board of Supervisors department is a 7-digit string, which is 10001. In the New World system, it's defined as 10. So that's under that string of information for departments, 10 describes the Board of Supervisors as a department. For example, the auditor controller is 20. And so what we've tried to do is really simplify the string as best we could, and then, by simplifying it, hopefully it will provide us the opportunity to also put a lot of detail behind that information, behind that, that 10 code for the Board of Supervisors, so that there's information, management information to make decisions upon. I'm just going to put this in here. Hopefully I can get this to work. So that's the system.
Joe Paul, I'm getting our accountant, our in-house accountant nodding, but I guess my concern is I always thought you gave yourself a few extra numbers in case down the road you need to stick something new in between two others. And it doesn't sound like you're giving yourself much
Well,
room.
remember,
like
that's one department, that's one field in 4 fields. So, for example, the fund field. Yeah, general fund, we have one fund. That's 101. Department is 10. Division, that's another,
okay.
that's another field.
So, okay.
We have a lot more divisions than we have departments or funds.
Gotcha. Okay.
And then there's an opportunity to drill down even further with the PSAs, which are for program-specific activities. There we can measure, for example, if we have public information requests. At that level, we can assign, the time that county council puts in, that the CAO puts in, that the auditor controller puts in, and any other affected departments, to find out what is the cost of, providing information when it's requested. There are a lot of opportunities for which we can measure measure time, measure costs in this system that will, help us manage resources.
Okay.
That's the whole goal here. I just wanted to open up a file here. Sorry, I can barely see on the screen here. Oh, I'm sorry. Okay. This screen kind of describes the 5 phases of the ERP system. The initiation phase, that's already been, really that was 3 years of initiation to finally get to the point where we actually signed the contract, and we started up in January with the kind of the groundbreaking for the ERP system. We've gone through the planning phase, which is the actual meetings where we talked about, hey, what do we want to, get out of the system? What are the chart accounts need to look like? Because we have absolutely changed. We didn't assume anything of the BITEC system. We didn't assume that we would want to create the exact same thing in the New World system. What would be the point of changing over if we weren't going to improve the system? So they're in the planning phase. We're somewhat at the end of the planning phase, because we're going kind of back and forth between planning and construction. You saw a lot of the GL accounts that we've been constructing in there, and we think that we're going to be done with the construction phase somewhere in the end of April, early May. And then the transition to actual training on the system will be in May and June, late May and June. And July 1st is our go-live date. So this is where the rubber hits the road. We'll find out if all our work is going to work. We hope it will, but what's interesting about a county ERP system is that it by itself will not work unless a bunch of other systems outside, for example, our C4 system in Health and Human Services, if that system is not designed to interface with our ERP system, this is a no-go situation for July 1st. Even if everything we did correctly in the ERP system is ready to go, that system needs to be able to talk to the ERP system to make this happen. For example, our bank reconciliation with the county treasurer's office. If the treasurer cannot, interface the bank files from the Bank of America with the ERP system, we're not going to go with this. So there's a lot of variables out there that we are working in defining and making sure that they're going to work in the new system.
Mr. Chairman, along those lines, aren't we making sure, as we're constructing it right now, that those systems will work? It's just not a matter of just flipping the switch in July and keeping your fingers crossed. I hope that's not the case.
No. No. These are things that we're working with. We've just now started the interface phase, where we are looking at these outside systems and working with those vendors to ensure that their definitions are going to be supportable in our system. And so we need to work in our ERP system to be able to import their information so it comes into our system the way we need to see it come in.
Okay, and if it doesn't, would have to change their systems to make it work and probably use the same system over there in the department?
Not likely. It's more likely that we have to change to accommodate the way their systems are designed to make it work for us. And
Okay.
that was written in our contract. We have.
All right, so it's written in the contract, and it's probably not another added cost or time delay in our implementation.
No, because one of the things that we did, and why it took so long to get to the point of actually being in contract with a vendor, is that we hired Wildam Wildam Consulting to come in and help us define what exactly we need out of the system. And the appendix that is very detailed, the appendix in the contract of all the functional specifications is very detailed, and we have included all those things in all those requirements so that the vendor has to meet them. So, we think that we're well protected from the county standpoint to ensure that, this project, is a success.
Okay, that was my question. Thank you.
Supervisor De La Cruz?
Thank you. Joe, will you have a backup system, at least for the first reporting cycle? In other words, will you have the old-fashioned in place as a skeleton system to make sure that if the new system somehow, the 8 doesn't recognize the 8, for some reason, you'll have the old skeleton system in place to make sure that those glitches are fixed?
Well, we plan on running parallel systems, which is the Bitech and New World, for hopefully, at least one quarter after. And it may end up being 2 quarters, but we kind of have to play it by ear to see how how it works out. We expect problems. It's a if you don't expect problems, it's not being realistic. So our plan is to ensure that the county has its accurate fiscal data, either in BITEC or in New World, but our goal is to transition over to New World as soon as possible.
Yeah, I remember in the private business, I actually did a transfer, and I didn't find out until maybe a couple years later when I needed to use a special button. It wasn't allowed in the new environment. And just, guess, you try to work around those things.
Yeah, that's why I think we spent a lot of time defining what exactly we need to get out of the system, and those are part of the contract terms. So if there's no other questions, I'll
continue.
Thank you.
I also wanted to thank the auditing team, also the department heads, and all the employees that have been working on this. There's been a lot of employees that we've been bringing in into those training sessions that Joe Paul just mentioned. And just want to make sure that, tell everyone thanks, but also, too, bring in awareness to the board, to the department heads, as well as the employees, that this is coming down. We're, in a process, and we'll be receiving some more training coming soon, as well as implementation. So I just want to thank Joe Paul for that. We also have another department head announcement from our Fire Chief O'Connor.
Good morning, Chairman Munzer and Board of Supervisors.
Good morning, Chief.
As your fire chief, I'm required to give you a quarterly report, and I'm enjoy doing that. Basically, the fire department's running good. About a year ago, we were here giving the proposal. It was April 23rd when you adopted that. We were at 21 firefighters in the city of Hollister and 6 in the county was our number. We're now at 28, so we're a little bit above what we were a year ago. On April the 5th, we'll bring on our SAFER grant recipients, which is 12 additional firefighters for the community. Those will be here for 2 years under the grant, and hopefully extended additional years as we can get the grant to be extended. I'm inviting you all to the swearing-in ceremony. It's on April the 3rd at the Vets Memorial Building at 6 o'clock in the evening. Approximately about 15 to 20 minutes to swear them in, do the badge ceremony, and there'll be some cake and refreshments afterwards. So all the Board of Supervisors, I hope to see you there. As far as the department, it's running fairly well. We've had a few major fires during the year, but we were able to handle with the resources we had. We've also been able to staff up additional resources if needed during those times. Our worst day, I guess, we had 8 engines and a truck and a rescue all staffed on different calls with one piece of equipment still available for additional calls that day. So that was our highest volume day. But other than that, it's been running pretty good. We've been able to use resources, move them around, and drop any boundaries, and whatever quickest piece of equipment, roll to the call and take care of and mitigate that issue, take care of that call. We're running right now about 2,500 calls for the year. Since last April, at this time, we're looking at about 3,400 calls per year for the fire department to be responding to. So it gives you a volume of our calls that we're responding, about 300 calls a month in that average. And if you have any questions, I'd be more than glad. The only other thing is I will be on April 15th bringing to you the location of Station 3 and asking you guys to adopt that location, and we'll talk more about that on April 15th. Just to give you a little heads up.
Supervisor Patel?
Oh, well, that was exactly what I was to ask you to maybe give the
I
rest
read
of
your
the board
I read your
members.
mind there.
Yeah, you're way ahead of me, Mike. And, being, at the fire committee meetings, we hear a little bit more detail of the progress, and we're looking forward to that 3rd station that will be available for North County, and it seems like the city of Hollister and County Fire making some real good progress along those lines.
Thank you.
Any other questions? Okay.
Come on. No.
Yeah. No, Chief, I just want to thank you for all your hard work and the hard work of your staff, and I think the consolidation has been going along very well. There's been a few minor glitches, exactly, and
All right.
but by and large, it has been going on excellently. Thank you.
Anything new is going to have hiccups at times, so.
Exactly.
But no, I have a great staff, and the young guys and gals that I have working for me are done a great job. They're doing a great job. They're there for the community.
Actually, is Station 4, the San Juan station, is that open yet?
Station 4 is completed. The firefighters are there. There's still a little bit of painting that needs to be done. We're hoping, and I'm crossing my fingers, that this month we will have an open house there for all the community of San Benito to check it out, but especially it's the city of San Juan residents to come by the station and take a look at it. And then I'm hoping in October, Fire Prevention Week, all of our firehouses will be open. Station 1, the newly built station, for everybody to go through and have some kind of activities at each one of the stations, so the community get to know their firefighters and their fire stations. So.
Thank you very much.
Okay.
We also have another announcement from our Public Works Department. We have Steve Wittry here to give a department head announcement.
Morning, members of the board and the community. I just wanted to let you know that the work on the Cienega Road bypass is nearing completion. We probably will be able to handle traffic in the next week and a half or 2 weeks, which brings me to 2 points. One is, would the board like a ribbon cutting ceremony for that opening of that new road segment, because it's been a long time in the coming, and to think about that, and you can let me know later. And the second part of that is, as we open Cienega Road, that goes around and removes 2 dog legs from that existing road, one of the things that we will need to consider is the changing name alignments for Cienega Road. There's a lot of problems in terms of how Cienega Road and emergency response, where they will go and what routes they will take. And we've been meeting with the address committee and are trying to come up with a plan as to how we can address this on a more county-wide basis, because Cienega Road is one of the more confusing roads. And actually, if you can picture where the Presbyterian Church is on San Benito Extension, as we all call it, that still has a Cienega Road address. So one of the things we need to try to figure out is how we can make Cienega Road, Union Road, and the other side of Cienega Road more accessible and more understandable to someone who would just move into the community and maybe driving a fire truck and trying to figure out where they're trying to go to respond to an address. So the address committee is looking at that process, and we'll be considering that matter in June. So after that time, there should be some actions to the board to try to figure out how we can straighten out that situation so that it'll be clear for any of the new members of the public. I think people who are here know what it is, but anybody who comes in new will have difficulty. So.
Supervisor Botello?
I thought we had that discussion already, Mr. Chairman. I thought it was supposed to be Munzer Drive.
No, I do not believe that was discussed on.
Okay, there's your April Fool's joke.
Okay, you're gonna be fine in the spirit of Rotary for that one. Any other questions?
No, I still think that's a good joke.
We have another department head announcement. We have Lisa Reinheimer from COG to give you an announcement.
Good morning, Lisa Reinheimer, San Benito Council of Governments. I actually have 2 announcements for you this morning. The first one is that I've been working with some community members as well as 2 schools in the west part of Hollister on a Safe Routes to School implementation plan. And I am here today to announce that we will be having a public meeting at R.O. Hardin School to talk about safe routes to that school this evening at 6 o'clock in the multipurpose room, and everybody's more than welcome and invited to join to tell us about what they feel are good walking routes to school, some of the traffic problems that they see around that school, and ways to encourage more people to send their kids by walking or bicycling. The other public meeting related to Calaveras School is on April 8th, next week, at 6 o'clock at the Calaveras Elementary School in the library. And I thought it was interesting that the CAO mentioned some enforcement out on Buena Vista. That's one of the things we've been looking at as well in the Calaveras area. And one of the things that we've identified in our plan that we will be bringing back to the board in May, to this board. I'm going to take it to COG first in April, and then bring a presentation to you in May, working through your CAO. We're looking at speed feedback detectors on Buena Vista. Those are the ones where you drive close to them and it sort of flashes a signal to you that you're, going over the speed limit, or it gives you the speed limit in which you're going. So hopefully that'll provide some additional enforcement out there as well. So those are the two public meetings that are coming up. The other announcement that I have is that San Benito COG has released a draft regional transportation plan. It looks something like this. So what we're doing right now is we are taking comments on it until April 1st, and it's our long-range plan consistent with the city and county's general plans, the county's draft general plan, and it looks at the transportation projects that would be needed over the next 20 years to meet the needs of the community, looking at the existing system and what the demands would be in the future. So I just wanted to let you know that that is out and available, and we welcome your feedback and comment. Thank you.
Lisa, did you say you're
Yes.
taking comment till April 1st, today?
April 21st.
21st. I'm
Yes.
sorry, I thought you said 1st.
I could have, but I meant 21st.
I have a question, Mr. Chair.
Supervisor Barris?
Yeah, thank you. Lisa, thank you so much for informing us of this. I know that most of our local schools were designed for children. They were built in areas where children would be walking to school, and obviously that's not the case. And with the parents worried about safety and the roads not being safe, that has become a major issue. Gobbleland Hills, where I drive down Santa Ana Road, that's a major, major problem. A lot of accidents have happened there, and I'd like to know if there's a plan for this type of conversation and community information for that school.
You must be talking to the principal of that school, because I had the same comment from him when I went to the Hollister School Board last week. And they expressed some great interest in safe routes to schools. But at this point in time, we're just looking at R.O. Hardin and Calaveras schools because we were able to get a grant to do the planning work. I suspect that moving into the future, it will be a great success, and there will be a lot of pressure to move on to the other schools. And I know there's interest to do it, but at this point in time, there's no money to do it.
Okay. And I haven't been talking to the principal, but I drive Santa Ana Road every day, so I'm very well aware of the issues there. But that's a good start, though. At least we're moving in the right direction for some of the schools.
Yes,
so.
and a lot more detail will be presented to you as to what we're looking at in early May when I bring it back to your board.
Okay, thank you. Thank you, Mr. Chair.
Any other questions? No. Okay. Thank you, Lisa. Anybody else?
That's all the announcements that we have.
Okay, we will move on to board announcements. Supervisor Botello?
None today.
Supervisor Barris?
Yes, thank you, Mr. Chair. I have two. On Wednesday, the 26th, myself and our Health and Human Services Director, Mr. Riding Sword, and our Homeless Coalition Representative, Doug Emerson, we attended the Leadership Council meeting in Marina, and where we approved a formal letter of endorsement as the Monterey and San Benito County Continuum of Care to the Housing Resource Center. And that endorsement was to request, funding that is available from the Department of Veterans Affairs. There's availability of up to $600 million in grants for nonprofit organizations. And Monterey and San Benito counties have been identified as targeted communities with the ability to apply for a $3 million grant, $1 million per year for 3 years. And the VA now requires a formal continuum of care endorsement, which we are a member of with Monterey, and it gave us the opportunity for, as a nonprofit, to submit the application for these funds. So hopefully we will have some good news in the near future, but it all deals with. Primarily dealing, like I said, with VA families, the homelessness that affects veterans. So, thank you, Mr. Chair. Oh, one more. I attended the joint boards meeting at San Juan Oaks last month, and it was where all the school boards of San Benito County joined together for a meal and to talk and support about children and the education and quality of education that we provide for our children in the county. So it was very well attended.
Thank you.
Thank you.
Supervisor De La Cruz?
None, Mr. Chair, and Supervisor Rivas also said none.
Okay. I'd like to report that I had the privilege of attending my first RCRC meeting this past week in place of Supervisor Patello. And it was interesting to hear that there was a group that went to Washington a few weeks ago, and they were basically told that because it was election year, nothing was going to happen this year, because nobody wanted to take an issue. Now, does that sound any different than any other year with Washington lately? So anyway, that wasn't encouraging, that they came back and basically they were hearing from staff that nothing was going to happen in Washington. But the Williamson Act was discussed, and then some other concerns. There was a lot of talk about the forestry and the northern counties, and they're trying to deal with the federal government, which they're having about as much luck dealing with the federal government as we're having dealing with the federal government and Clear Creek. So anyway, with that, we will move on to consent agenda. I believe there are no items that need to be pulled by the board. Is there anybody that would like to have an item pulled by the public?
Number 8.
Is there anybody else in the public that would like a item of the consent pulled? Seeing none, what's the pleasure of the board?
Motion to approve amended agenda, Mr. Chair.
Second.
I have a first and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. And Mr. Espinoza, we'll move on to item 8.
I think item number 8.
Lauren Hanson.
Yeah.
Good morning, supervisors. My name is Lauren Hanson. I may go a little bit over the 3-minute time limit, and I hope you'll allow it, but if not, you can just cut me off. I'm an attorney with the Public Interest Law Project. I've been sending you the letters about the General Assistance Program. My organization works statewide to ensure access to public benefits and affordable housing. I'm a fellow there. I split my time between both units. In the past year and a half that I've been there, I have had a chance to work statewide on general assistance and have a pretty good familiarity with what other counties are doing and what the laws around the program are. I just want to thank the county up front for being very, very cooperative and coming to the table immediately when we alerted the agency to various different deficiencies with the program. We really appreciate being able to work this out, particularly without having to go to any sort of litigation over the issue. With that said, and we really think the handbook that's in front of you today is a good one. We support the approval of it 100%, with the one exception of the 3-month time limit that is in the handbook for people who are deemed to be employable under the program. So there are 2 general categories of people who are going to be classified as either employable or unemployable in this program. From what I've observed working statewide on a general assistance caseload, approximately 75% are actually deemed to be unemployable usually. So I looked at the most recent statistics for this county that were provided to the state in January of 2014, and the caseload is currently, as of January, 35 people. So if you're using that 75% statistic, then there's only about 9 people that you're going to be classifying as employable. The people who are unemployable are not allowed to be time limited. So you're really time limiting about 9 people at this point. I know that some, maybe all of you, don't actually even want this program. I appreciate that. I actually grew up in Colusa County, which is a very small conservative farming town.
I went to law school in Iowa, and then I practiced in Lake and Mendocino counties. So I have been in rural areas more than I haven't been in rural areas. I also grew up on public benefits, so I know what it's like to be in a rural area and in poverty. There are so many people in my community who did not support offering public benefits, went to the extent of saying that welfare recipients should be cattle branded so that the community could more clearly see who is taking advantage of the system, and I'm putting that in quotes for the people who aren't looking at me. So I understand that there's probably significant opposition to providing these benefits in your community. Clearly, there are stigmas attached to welfare. I promise I will wrap up in just a minute. But I'm just here to say that these benefits actually do matter for people. Having assistance makes it much more likely that the person's going to be able to get a job and then get off public assistance. 3 months of aid is really no time at all. I can't actually imagine getting a job myself in 3 months, and I have job skills, I have education. One last thing, I represented a client, I used to provide direct legal services before my job now, and I represented a client who was on general assistance, and she is a Vietnamese Buddhist nun, and she came over to the States, and she became disabled after she fell and hit her head on the sidewalk. And so she tried to navigate the SSI process. I'm sure all of you have heard of or are familiar with SSI. It's a disability insurance program. And she was trying to apply for these benefits, and she failed because she couldn't get through the system without an attorney. So she found an attorney, but in the meantime, she had applied for general assistance just to hold her over. And in that time, the general assistance benefit in Mendocino County was only $100. For reasons I'm not going to go into, they were denying her benefits, which we challenged and settled favorably. But the point being, though, is that they were time limiting her. She was disabled, but they were time limiting her because of this rule. And she was so patient during the whole process. She was living on food stamps, and but her friend came into my office one day and she said, "No, Lauren."
Okay, if you can summarize that.
Okay.
And I have a couple of questions for you.
Oh, sure. I'm happy to answer questions. She said, Lauren, your client isn't going to tell you this because she's too proud, but she has no money. She's trying to live off of food stamps. She has no money to buy soap, and she doesn't have any money to buy toilet paper, and she's getting embarrassed. And we eventually got her that $100, and for her that was enough. I don't know how that's enough for anybody, but that was enough to get her by until she got her SSI. So anyway, to sum up, sorry for talking over the time, but this is a really small population. This is a small caseload, and I know it's expensive. I'm aware of the limitations, and we would just like to encourage you either to not adopt the time limit, but in lieu of that, to try to do either a trial period or at the very least look at it in the future to see how it's actually affecting the people who are on the program. And I'm happy to answer questions.
My first question is, you talk about in your letter that we will be repaid for the grant once the recipient receives the SSI.
Correct.
Now, is there any time limit that they can be receiving the money from us? And then if they're on for a year and a half, we will receive the whole year or year and a half back
Correct.
once they receive SSI?
Yes.
Okay. And then my other concern is, again, in your letter, you point out that 10 out of the 58 counties, only 10 out of the 58 counties
Yeah.
go beyond the 3-month period.
Yep.
So I have a concern about that why is it that the other 48 counties or 47 counties do institute the 3 months time limit?
Sure. I mean, I'm sure people have different reasons. The common ones are there's no money, and they want to divert the money to another issue in their community. This isn't a legally mandated requirement, right? So you can just do 3 months, and so often counties do choose to do the minimum. I don't think it makes fiscal sense in the long run to do that. But I also will just point out that there's no other public benefit program, at least no other major public benefit program that I'm aware that time limits the aid, and there's a reason for that. It's because it doesn't work. So I think that what happens is that it does look like a savings in the short run. It does. I'm not going to say that it doesn't. But I do think that these costs are transferred into sort of other areas into the community. Like the Homeless Coalition is going to see more and more people who aren't able to get housing. There are going to be people at your food banks when their food stamps run out and they have no cash. So I do think that there's public health concerns, and I noticed that there's some public health presentation on your calendar and on your agenda for today. And one of the things on that part of that presentation is the recognition that there needs to be less poverty in order to create a healthy community. So that's my answer to that.
Okay. So, and we're talking with staff, I have the assurance that if we institute the 3-month time limit, that will be revisited in a year after we've kind of gone through it. So, are there any other questions from the board?
A comment, Mr. Chair, if I could.
Supervisor Barris.
Thank you so much. I appreciate your passion for the people that are in need. And I want to say, and I think that I speak for the rest of the board, that we do support general assistance. We have a lot of programs in our county where we supported grants that come in, and we make sure that those funds are used for the proper, need. But we have to limit it. Without a limit, we wouldn't be able to function as a board because we have to budget ourselves. But I like your idea about assessing after let it trial period per se, and let it pan out and see if if it isn't working, then we will revisit it and see what else we can do to tweak it. But I thank you for your comments. Thank you, Mr. Chair.
Great. I appreciate the time. Thank you.
Supervisor.
Yeah, I wholeheartedly agree with Supervisor Barrios, and I read your letter, and certainly I wish we could extend it to a year or unlimited, but this county cannot. I just don't see how we possibly can. You were here a little bit earlier with the IHSS folks, and when you move, this is a little bit more than what we budgeted, and we only have so much to share around to a lot of different programs in which these people qualify for other programs as well, assistance programs, both from the nonprofit or sector and government sector, and so I think we have to move in this direction for the time being, and because all these social programs have to kind of work with each other, and that's what makes our job so difficult. But I appreciate you coming in this morning and giving us the information that you did, and we'll certainly keep an eye on how we could improve going
Great.
forward.
Thank you so much.
Is there anybody else in the public that would like to address this item?
Richard Betancourt, 4140 Southside Road. I was going through the document on my computer this morning, and from what I understand, it's a loan to these folks to be paid back. Can they explain that to me? Maybe I misread it. I don't know.
Jim, would you like to?
The gentleman's correct. There are liens placed, just as we place liens in the Medi-Cal program, so that if funds in the future become available, the county has a right to ask for those funds to be repaid.
Any other questions?
Nope.
Okay. All right. Thank you, Jim. Any other questions or comments from anyone in the public? Seeing none, I'll bring it back to the board.
Mr. Chair, I'd like to make a motion that we adopt resolution 1427, adopting the San Diego County General Systems Policy and Procedures Handbook with incorporates the new standard of aid and sets forth the policies for the administration of the General Assistance Program, and 2, have the department come back in a year and update the board. 3, authorize chair to sign, and 4, approve budget augmentation to cover the projected cost of $95,000 for the remainder of the fiscal year.
Second?
Okay, we have a motion and a second. All those in favor?
Aye.
Those opposed? Passes 5-0. We are ready to move on to the public hearing. Mr. Espinoza?
Thank you, Mr. Chair. Yes, we're on item number 12 on our agenda this morning, and the recommendation from staff is to open a public hearing of the activities in the proposed 2014 CDBG grant application and receive input. So we have James Riding Sword, our Director of Health and Human Services, as well as Enrique present to comment on this particular item.
Where is it? Okay. All right. Well, this has been, I guess I would call it an enormous undertaking. On January 9th, I was invited to attend the Intergovernmental Committee, and at that committee there was a discussion about the homeless in San Benito County and Hollister, and we were asked to move forward to see what we could do. Well, at that point in time, we knew that we could apply for a 2014 CDBG application, and so we began to move forward with that in 2 areas, public facilities and public services. So the purpose today is to discuss the CDBG block grant application and to provide citizens an opportunity to give input to the Board of Supervisors and the community. And then we would like to come back next week at your April 8th meeting for you to take action on the final application. This will give us time to incorporate and consider any comments that we might hear today, either from the community or from the board. I wanted to take, well, just kind of say that we're applying for $2 million. $500,000 is in public services. Part of that public services will be for domestic violence programs with Emmaus House. Part of it will be used, if we are successful, to help support a homeless center that you'll hear a little bit more about today. And part of it will be used to support some youth activities in the community. The $1.5 million on public facilities is basically to construct a facility that has been reviewed extensively in the community, and it seems to be the one that will work for us. Seemed for a while things changed every day. As a matter of fact, sometimes they changed in the middle of the day. So it was quite a challenge for our staff and everybody who worked on this to keep up with that. So I want to thank Enrique and his staff and Public Works Adam, particularly for working with us, the Homeless Coalition for hanging in there and helping us see the right way to move on this. And I just want to do a quick review of since October. Here is a list, and these are in your packet, of all the meetings that we have recorded that have taken place. It's actually 2 pages. I just wanted to let you know that this has been extensive review and community process, lots of discussion, Supervisor Barrios has been in on many of the meetings. The Mayor of Hollister has been an important part of linking back to Hollister for us. He and I went to a homeless summit in Santa Barbara in, I think it was February, where we learned a lot, brought a lot back to the community about long-term planning. This CDBG grant, in my view, will give us a first step towards working towards the solution for homeless issues in San Benito County, and that was one of the directions from the Intergovernmental Committee. Again, just to finish up the list of, the meetings and everybody that we've talked to in this process, I just want to be clear with the board that there has been an extensive amount of discussion, communication, and so forth behind all of this since January. And I want to really thank the staff in Health and Human Services and in Public Works in particular for the work that they did on that. I'd like to turn the rest of this presentation over so Enrique can briefly run through with you what we are proposing to the state.
Thank you, Jim. Okay, so as Jim said, we're submitting this proposal in the amount of $2 million, and $500,000 is under public services, same category as we've applied the last 3 or 4 years. Of that $500,000, $200,000 will be earmarked for the operations of Emmaus House, which is a shelter for victims of domestic violence. $200,000 for homeless advocacy service, provide outreach, case management, supportive services, and one of the goals is to link our chronic homeless into services that they may need to assist them with their daily necessities and also ultimately in stable housing. $62,500 to support youth activities, and this is more in alignment with enrollment in recreational enrichment activities that the low-income community would normally not be able to afford. And of course, the state allows us 7.5% for admin, which in this category equals $37,500. As Jim said, for public facilities, $1.5 million to support this, I guess, year-round facility, which will be mostly as an emergency type of facility, shelter. It's going to be equipped with a 52-bed dormitory, showers, restrooms, lockers, mail services, commercial kitchen, and private counseling room. In addition, this facility will be used for the operations of the emergency winter shelter that's operated by the Homeless Coalition. Supportive services will also be provided to enhance living stability. This place will also have a space for what's called day center for those that need a place to go and take a shower and take care of their basic necessities. Again, 7.5% will go towards administration fees. Here's a site plan. In discussions, and we're getting close to getting the willing letter seller by the owners. It's located behind HHSA. On the right-hand side is an empty lot at the moment. It'll be next to the future site of the food bank. The building, dormitory shelter, as you come in towards the bottom, that's where the staff will be. That's the day room to the left, to my left. I don't know if it's your left. This side over here. That's the dormitory. That'll be for unaccompanied males. To the farthest side is space for women. That's a 14-bed. And for the males, I forgot to mention, is 30 beds. And then there's 2 small rooms for small families up in the top. So we find that there's also a need to provide shelter for small families, and at the moment, 2 is the most that we're able to propose. There's also the facility for kitchen. It also includes the dining room. There's a patio, laundry room, restrooms. This application is due on the 11th. The goal is to get it in, drive it, to be assured that it gets in by the 11th. I also wanted to say that there's a sign-it sheet in the back for those that, we hope that you do sign it for support. These documents will be submitted to the state along with the notes. Also, for those requiring Spanish translation, we have Sylvia here. Para personas que requieran traducción, aquí está Silvia, que podrá ayudarles. Silvia, levanta la mano. Let's see. And also copies of the presentation are in the back for those that would like a copy of that. That's it.
Are there any questions of the Supervisor Barris?
Thank you, Mr. Chair. I want to thank staff. I want to thank Jim, and I think this has been a very aggressive plan, but a very much-needed plan. It all came out of the intergovernmental, and as you all are aware, the homelessness situation is growing, getting worse. And as I was driving over here, I realized the necessity. I believe today is the day when the folks are not able to stay at the emergency shelter. Am I right, Enrique? If it isn't today, it's real close.
I believe it's been extended to April the 15th.
Thank goodness, because I know they have to leave there by 6 o'clock in the morning. I'm driving over to the board meeting, and there's these folks sitting there in the rain. And one of them I recognized, and I see him walking all the time, and it would be wonderful to be able to provide this kind of service for this community to keep these people in an emergency situation off the street, be able to provide them a meal. And I think we're headed in the right direction. We're doing what is right for this community. Not only will it enhance the quality of life for those folks, but I think the quality of life for San Benito County in general. So I really support this effort, and I thank everybody for doing it in such a short time. And I want to say that the reason that we are able to do this is because, and that our county is eligible for this funding, is because we met the 50% rule. And the 50% rule is not an easy rule to meet. But yet we have a department that did it, and we're now eligible for these funds. So I hope that we get the support from the rest of the board. Thank you, Mr. Chair.
Mr. Chair,
Supervisor De La Cruz.
on the other member of the Intergovernment Committee, I commend Supervisor Barrios for being very active in this cost and worthwhile opportunity. I also thank Jim and Enrique and the rest of the staff for doing a good job of having the visionary idea to move forward in this direction. I really thank them a lot. I just hope that, I always say, seed money for projects, facilities is the easiest part. It's the ongoing expenditures that needs to be addressed. Today we can all support it and approve it, and I hope we will support it today because it's about grant money, it's about facility money. I just hope that in 2 or 3 years, when this operation is fully going and it's benefiting the community, you don't come to the Board of Supervisors, ask us to allocate fund from the General Fund Department to continue for these operations. That's my only concern that I have, is competing for those dollars that we have, that we've got to make a decision between public services, keeping the library open, providing law enforcement food out in the community, and turning on and off the lights. I just want to make sure that those will not be competing against this great project. Once that dollar it's identified, this is a great project. It's a long overdue. We need to move forward with it and hope that the rest of the community buys into this concept too. Thank you, Mr. Chair.
Jim, do you have a...
Yeah, I did say this is a first step. Next Monday, the planning group is going to get together and we're going to start talking about where do we go from here. We know that the eventual solution needs to contain a major component of permanent housing for homeless folks in our community if we are going to address this issue. And we know that we need to identify where are we going to find those funds in order to support an ongoing effort? So that is an appreciated comment from the supervisor.
Supervisor Rivas?
Yeah, I do have a couple comments, and certainly the issues that the application addresses is a significant need in our community, but there also are other needs within our community. And although I'm appreciative and I support what the application is addressing, I think that for me there's an issue of transparency involved in this entire process. I think this is a process that was really motivated through intergovernmental to address a need that we currently have. It went, we recently heard that this was an expedited, process. And I look at the timeline, and I think a big component of the CDBG is the fact that you need to have participation from your local citizens. And I see that that didn't exist in this timeline. When I look at the timeline, I look at elected officials meeting with staff, certain organizations. And I think that as a county, we fell short in reaching out to local residents to address, to really get a full grasp of what our needs were in this community. Like I said, I've been a member of the Homeless Coalition. I think that this is, I'm supportive of this application, but in future applications, we need to do more to really look at what, to really do more to have an outreach plan to talk to the citizens that these grant monies are going to impact and improve their lives. I'm a little frustrated at how this process move forward. I just hope that we can fix it in the future. Thank you, Mr. Chair.
Yeah, I guess, I shared the same concerns as Supervisor Rivas. In fact, a few weeks ago, I mentioned it to our CAO, and I was able to get some clarification on this process. And that's not to say that I don't appreciate the tremendous amount of work that the staff has done to bring us to this point. This is an issue that we do need to resolve on a permanent basis. What we have for a facility for the homelessness is completely inadequate. It's only part-time during the, and as Supervisor Barrios stated, that it does have a quality of life issue, not only for the people that we all see that are on the street, but it says something about our community when we have visitors or people that may be interested in investing here, that if they see that type of issue out in the public. And we also need to be able to convey the services that seems like it's the theme this morning to people that are in need. And by going in this direction, which I fully support, we're one step towards that direction. And but I agree with Supervisor Rivas that keep working very hard with the outreach portion of it. We do have organizations, the Homeless Coalition, the Emmaus House, there's a lot of money and their cooperation and our understanding of their organization for the efficient use of these grant funds needs to be very well orchestrated in that communication as well. But I'm supportive of this and appreciate all the work through the Intergovernmental Committee as well as the CAB board as well. So hopefully we're all working in unison, county and city. Thank you.
Okay. Mr. Chair, appreciate the comments from the members of the board. Once again, we see this as a first step. We expect next Monday to start the larger conversation. We're trying to invite as many people as we can to be at the table. We've asked for people in the community, particularly those who have worked closely with us during this process, to add to our list of people that should be at the table. And I think the long-range discussion needs to be a community discussion.
And I want to make the comment that I too share Supervisor De La Cruz's concern about the long-term financing of this. The other concern I have is if we were to receive this grant, do we have a plan in place to spend 50% of it so that we can apply for another grant in a year or two? This is going to be a long-term project, right?
Yes, and that is a conversation that we particularly had with Public Works as to our ability, if we receive this grant, to hit the ground running and to get this going, and we have their assurances that we can make that happen.
Okay. And then my last concern is, and I know this is being discussed in intergovernment, is the city going to be stepping up and assisting us in this project?
In fact, the city has committed to, in the interim, while we're waiting to hear about this grant, is to help to do something on that property using their resources so that we can begin to do something sooner rather than later.
Okay. Thank you, Jim. Now, just before I open up the public hearing, so I'm opening up the public hearing and I'm not closing it today, and we're continuing it to
The 8th.
the 8th.
Yes, at a time certain. So the public hearing will be continued to April 8th to begin at 9 o'clock or as soon thereafter as the matter may be heard.
Okay. With that, I will open up the public hearing. Is there anyone from the public that would like to address this?
Morning, Chairman Munzer and Board of Supervisors. Thank you for the opportunity to address you this morning. My name is Doug Emerson, and I'm representing the Homeless Coalition, member of the Board of Directors. I've been on that organization for 9 years now. And I would like to make you aware that the Homeless Coalition fully supports this application for the public facility. As kind of been mentioned or alluded to, it was a pretty rocky road getting there, and we were scratching our heads at one time, but when we finally saw this presentation, and what you saw up here exactly fits in with our vision and our mission for the next step in dealing with homelessness. Supervisor Botello alluded to what we currently have at the migrant worker camp. It's true, our funding allowed us to go to the 15th this year. And we worked through all those problems with the Farm Labor Association, so we have a good relationship. To put something in perspective, when you talked this morning about coming in years past, as we go through March, towards the end of March, our numbers would be like 12, 10, 8. We had 21 people up there last night. So yes, it is growing. We probably averaged 20 to 24 up there this year, where in the past we've averaged 16 to 18 people. What this facility will allow us to do is what I just mentioned. It'll remove that restriction that come April 1st we have to leave. Our board right now has changed over the last 5 years. 5 years ago, we had a 5-year plan to have a year-round emergency shelter. What we're seeing now is maybe that's not the best use of funds, but we have a problem during the day. And what this facility will do is allow us, if we want to go in October, if we want to go in April, we don't have to get permission and work through all those other things. And it'll allow us to have that day center that now has become a focus for the coalition. A day center that, yes, where people can come take showers, maybe get a meal, but our vision is also a day center that's maybe going to have a health practitioner there, that's going to have medical services, that's going to have support from behavioral health, drug abuse counseling. So all those services now can be worked into that. Other restrictions we have up at the labor camp is, well, we have 24 beds. We can go up to 29 in emergency situations, but we can't serve families. We're under the same restrictions as those dormitories up there, which is unaccompanied adults. So there have been families in the community that we worked with. We have to say, no, we can't serve you up at the camp. We worked out some in the past with the Emmaus House where we could do some partnerships. But this facility will allow us to do that. And I just strongly encourage the board to support this application. Those facilities are almost exactly what our staff sat down with in January and said, here's what we need in the building. And it's there. Thank you.
Thank you, Doug. Anybody else like to address this item? Seeing none, then we will continue this public hearing to April 8th, 9 o'clock, or soon thereafter. With that, I'd like to take a 10-minute break, and then we'll start the regular agenda.
Yeah, we have a whole bunch in the back. And I had another color for you, but I think it's left.
not Pablo, but the defense was just terrible. Except for Pence in right field, he had a couple of nice throws, but Pablo was bad and felt screwed up. And
I turned it on. It was the bottom of the ninth. The guy hit the home run. I left it. I left it.
Was this the
And
A's
then
and
I
the
came
Giants?
back.
No, the Giants
And the game was
in
over.
Arizona.
Oh, in Arizona.
If we can reconvene. Okay, we'll move on to item 13, the first item on our regular agenda. Mr. Espinoza.
Thank you, Mr. Chair. Yes, again, we have Health and Human Services here, James Riding Sword, to give your board a report on the findings of the Healthy County initiative. We have James here. Thanks.
All right, thank you. So when I came here, one of the first things I learned about was the health initiative study that had been taking place, and in cooperation with funding from the Health Trust and with the Community Foundation. It's a pretty extensive report. I think you all have copies of it, and I think that if we're successful here, we will be able to go back and apply for additional funding from the Health Trust to move forward with this. I'd like to ask Sam and all her enthusiasm to come up and talk to you about what we've found.
Thank you, Jim. So I just wanted to make sure everyone did get a packet of our report, the HSBC report, and I'll refer to it as a HSBC report instead of saying Healthy San Benito Initiative report. I did compile summaries in English and in Spanish that are in the back, and Lynn is walking around handing them out. And also we have the PowerPoint presentation too, so if you want to take this information, because I'm going to be showing some information that you may find very exciting and want to replicate, want to look at. So anyway, let me go into a little bit about public health, give you a background. And I just want to mention that Dr. Garza came and spoke to you probably about 10 months ago on this subject when we were just getting up and started on this project. So first, I'd like to acknowledge the Health Trust. The Health Trust, we wrote a grant in partnership with the Community Foundation for $35,000 to conduct this assessment, if you will, the first stage of this project. And also all the partners of the core planning group. We had about 21 members of the community as part of the core planning group for this assessment. And we only anticipated like 13, but 21 actually helped us through this process, which was absolutely wonderful. And this was helping to assure the conditions of healthier people in San Benito County. And when I say health, I mean physical, mental, and social well-being, not just health in the true sense. So assumptions, we want healthy people and thriving communities in San Benito County. We want that for everyone in San Benito County, all races, all ethnicities, all socioeconomic classes, and all occupations. In San Benito County, we need to look at how healthy and thriving are we? Are healthy choices easy choices, everywhere, every day, and for everyone? Public health is what we as the public do to ensure the conditions in which our residents can be healthy. Our vision is healthy people and healthy communities in San Benito County. Our mission is to prevent disease, injury, and disability, promote physical and mental health, and protect from health hazards. We know as public health we cannot do this alone. We are just small public health, little public health. Big public health is all the other organizations that make up our community. We need to work together on this to make our community healthy. And I like to compare it to when we go to see our doctor and medical provider and patient. Public health is more of the medical provider, and the patient is our community. Community vision for San Benito County, healthy living, health in all policies, healthy affordable food, safe places to play and recreate, health tied to transportation, children's safe, healthy, well-educated housing, job, economic development, and county general plan. Long-term goals are to improve our community's health, obviously, and to work with community partners to prepare for public health accreditation, in which all residents have access to quality public health services that meet the national standards. Now, our HSBC process, again, was incorporated 3 components. The core planning group partners, which I mentioned were about 21 people from the community, everyone from some of us, some business owners, some Lisa from COG, et cetera, et cetera, et cetera. Community input and opinions. We actually conducted about 18 forums in our community to gather information from what our community believes are some of the biggest health issues in our community. We went out and interviewed people. We also had something, what you would call it, a link on the Community Foundation website so people could go on and actually express what some of their concerns were about our community's health. Baseline objective data, indicators, and assessment. We collected, and this is the epidemiology, we collected 45 different surveys. We researched about 45 different sources to identify what some of the needs are of our community. So, and that's all compiled in the actual HSBC report. So, health factors, looking at the health of our community. Economic, social factors contribute to about 40%. And when I say economic, social factors, I mean unemployment, high school graduation rates, poverty level, and if someone feels part of their community. This makes up 40% of our health. Health behaviors contributes to about 30%, and this is smoking prevalence, exercise, and practicing a stress-free lifestyle. And one of the studies that was very exciting for me was that there's 3 behaviors that make up 4 diseases which cause 50% of all the deaths in our country. And those 3 behaviors are poor nutrition, lack of exercise, and tobacco. They make up 4 diseases which consist of stroke, cancer, type 2 diabetes, and respiratory conditions. And again, that makes up 50% of the deaths in our country. Clinical healthcare systems contributes to about 20%. And when I refer to this, I refer to, do we have access to doctors? Dental prevention, mental health services? Do we utilize preventative care measures? Do we get our IZs, our vaccinations, testing, et cetera? And then physical environment, safe community. Is our community safe? Do we have access to healthy foods? Are our streets well lit at night so people can walk? Okay, so socioeconomic. When I refer to this, this is getting into our county as a comparison to the state norm. Unemployment in San Benito County currently is at 13% compared to 10% at the state. High school bachelor's degree, 18% compared to 30% at the state. Third graders who could read at grade level is currently at 36% compared to 46% at the state. 7th graders meeting the math standards, 36% compared to 50% at the state. 1/3 of 9th and 11th graders don't feel part of a group. And when I say a group, I mean club, I mean social activities, I mean extracurricular activities at their school, maybe a church group, et cetera. 20% of the 3rd graders surveyed, 3rd through 8th graders surveyed consider themselves chronic victims of bullying. 60% consider themselves sustained victims of bullying. And when I say sustained, I mean over 30 days and over. Health behaviors. Tobacco use amongst adults is 17.6% compared to 13.8% at the state level. And I just want to say that we were, in 2002, our rate was 16.2%. So we're actually worse in this category than we were in 2002. Tobacco use by youth is 10.7% compared to 10.5% at the state. Now, saying this, in 2002, we were 19.2% for youth smoking uptake. So we can actually see a hearty decrease in this. Exciting. Overweight, obesity in youth and adults. I don't know if any of you read the newspaper 2 weeks ago. We had an article in the newspaper. We just completed a survey, and we posted the data, and it was shocking. It was very shocking to us. 76.3% of San Benito County residents are overweight or obese. That compared to the state norm, which is 59.8%. So I did a little bit more research because I wanted to find out, how about our neighbors? In Santa Cruz County, 58.4%, and in Monterey County, 62.4%. So we are actually 17% higher than the state average. So I don't know. Anyway, 1/3 of San Benito County children surveyed watch TV for at least 3 hours a day. I say that at least. Healthcare. 13% of San Benito County adults report that they could not see a doctor due to cost. And then the ratio of care providers to the population, San Benito County. For medical providers, we have 3,084 compared to one person. Dental, 2,658 compared to one person. Mental is 11,104 to one person. IZs and flu immunizations, less than 50% of our community, our residents in this community get their shots every year. IZ rates, 95%. This is an area that we're actually doing better in than the state norm, which is at 90%.
Mr. Chair?
Yes.
On the ratios, like, for example, medical, 3,084 to 1. So what you're saying, there's 3,884 people, and there's only one medical provider.
That is correct, yes.
Now, did you take into consideration that a lot of these medical providers, they're into associations, or they have PAs, that actually the PAs are actually in seeing the patients?
Right, this is medical providers to patient. So if it's a PA or something like that, that's not taken into consideration with this. This is medical providers to patients. And for instance, with mental health, this is calculated for psychiatrists to population, not to an MSW or a licensed family care
Clinical.
Thank you. Thank you, everyone. Thank you. This is a communal report.
So if I go one step further with the question, just for fun, how many doctors do we have in this community? Would you take a guess, or because we got to get the ratio somehow? So, if I divide 3,084 into say 56,000, should give me the number of doctors we have, right?
Correct.
That's 18 doctors. So we only have 18 doctors here. Okay. Thanks.
Is that like once a month doctors too?
We probably have more that are probably transitional, that probably come in for certain specialties, et cetera, but for medical providers.
And then you have to remember that doctors have practitioners under them. So they have nurse practitioners, they have physician assistants. So I think that's how you would determine the ratios, just by the doctor.
This is regarding medical providers, licensed medical providers, doctors. But again, a lot come in from other communities. Santa Cruz County, they come in for a day here, a day there. I believe this means seated here. Yeah.
Yeah, that makes sense.
Yeah.
And before you go on, if you can go back to your last chart, health behavior equals 30%. I actually read your report last night. I had an hour and a half or 2 hours between a couple meetings, and I actually read through the report. And what I noticed was tobacco use by adults. What I thought I read in the report was San Benito County was better than the state average. And on your chart on the back of your handout, it also alludes to that, and yet you're saying, if I'm reading this right, that it's worse than.
Right, and this is a study that we just did. We just completed this study, was it last week? Oh, 2 weeks ago? Right.
So from the time you wrote your full report till this, it's changed that much?
Well, it depends on where the data is coming from also. This was going out and actually interviewing the community members. We actually went to all the 47 stores in San Benito County to access information about tobacco use, tobacco sales rates, et cetera, et cetera. So we did this at a local level. This data right here is probably compiled by a different source, which I'm actually going to go into in a minute when I get into our the launching of our community dashboard website.
So does that, your little chart here, does that call into question everything you've said in this little chart here from your original report?
Does it call into question? No, because the study that we did with the tobacco use was just primarily tobacco use. We didn't do a study with diabetes, anything like that. This was just a study for tobacco use.
Okay, but what I'm saying is your study of tobacco use gave different results than what you did through your initiative, the results you came out with from your initiative.
Right.
Does that does that bring into question all of your results for your initiative?
No, it does not. And unfortunately, our epidemiologist is not here to answer. I don't see Mary White. The data that was collected for the health disparities should not be in question whatsoever. It's concrete, valuable information. The sources are all CDC, CDPH, California Department of Public Health. There's nothing that should be in question with that, with regards to that. The 17.6 compared to 13.8 is the data that we did locally, because there's a lot of studies that public health, a lot of times public health will do their own surveys of the community. The data is not always consistent depending on what source you're finding the data from. There's going to be some discrepancies in the numbers periodically.
All right.
Okay, healthcare. Physical environment. Over 50% of the restaurants in San Benito County are considered fast food. 49% of our population works outside of San Benito County. 74% of daily commuters drive alone to work. And just to back up, when I say 49% of our population works out of San Benito County, I researched that a little bit more, and the average commute time for someone working outside of San Benito County is about 29.3 miles. So some of the reasons that our community members gave when we went out and surveyed our community was to find out, why do people not bike or walk more often, et cetera, et cetera. And some of the reasons that they gave is because of lack of paths. There's too many cars. The sidewalks are not even, so it's hard for me to walk because I'm afraid of tripping. And lighting. Lighting seems to be an issue for a lot of our community members. When it gets dark in some of these roads, it gets dark. So this is a typical year in San Benito County. So here we have a population of 55,269 people. On the left, it is the, let me see, yes. Okay, so live births, we've had, like for instance, last year, 768 live births, et cetera, morbidity rate. And then on the right, we have deaths, 270 last year, and from the causes of these deaths are reflected in these numbers. I thought this was a great snapshot to see where we have to focus as public health on our preventative efforts. So this is the community dashboard, and this is what I was talking about, Chairman Munzer, is that this was launched actually at 8:47 this morning, and I thought I was going to be one of those numbers for coronary attack if it didn't get launched, because I was really stressing, as some of the staff here can say. Whoops. So if we go to this gives us a snapshot here and now of San Benito County on over 100 different indicators. So this is how it looks when you come up. We go to and anyone can do this. This was made possible by a donation from Gavilan College and Vision San Benito County. It cost $30,000. We have access to this. Everyone here has access to this for the next year. It'll go down again in April of next year if we don't find an additional $20,000 to maintain it. So for a grant writer, this is phenomenal information. So let me just go to it right here. So we have adults with health insurance, et cetera, et cetera. I want to go down to, if you look on the far right, that's sort of like a visual for us. If we're in red, major problems. Let's see, okay, adults with diabetes. Right here, let's go to here. Okay, So it's saying that 17.5% of the population currently, of adults, currently has diabetes. Why is this important? The source of the information is down here, UCLA. The ages of adults with the onset of diabetes, it seems like it's hitting 23% of this population between 45 and 64. Gender, more women, 20% women, female, and then the population. And then on the right, I just want to show you this. So these are promising practices. So for instance, if we see this as a concern in our community and we want to take action against it, we would look for the promising practices that have been utilized by other communities. And then if we wanted to apply for a grant for it, funding opportunities right below. And that will tell us exactly who's putting money out into this and then how can we apply for it. So this, and as I said before, there's over 100 indicators in San Benito for San Benito County, and I just want to go to the disparities really quick. I mean, not the disparities, but the demographics, because I think that you would find that useful. And ironically, if you go on the website for adult smoking, it comes up with the same amount, and adults for overweight and obesity for San Benito County, 76.32. So if we go to demographics, right here, so what we used to do, and I'm old school. I remember back in the days when you'd sit at the library and go through microfiche to try to obtain all this data and research it out, and it would take days and days. It's right here at a snapshot. It's San Benito County compared to California, the state of California. And what is so awesome about this information, too, is that it's San Benito County specific. And it's real-time information. So, like, if you look at when was it updated last, most of it was updated in February. Some of it could have been updated in March, because I looked through quite a few of them yesterday, and they were all updated in February of this year, which is phenomenal. So it's real-time information, and it's not incorporated with another county. Many times San Benito County data is incorporated with Monterey County or Santa Cruz County or Santa Clara County. This is all for San Benito County. So you can go down and see how many, the median value of a house, of an owner-occupied house for a certain period of time. Private non-farm establishments. And if it is like 2011, that's because that was the last time it was surveyed. Land area in square miles, et cetera, et cetera. Voter turnout. We pulled up voter turnout, and it looks like 72% of voter turnout. And then it shows us, like, in comparison, male versus female, what population of the community is voting more than other populations in the community, et cetera, et cetera. So pretty much anyone can find this information useful. As a grant writer, this is just the quintessential data research information for us right here. Is there anything that anyone would like to look at for San Benito County?
One of the things, yeah, you mentioned a little bit earlier as far as how many surveys to get these statistics. Where did you pull those surveys, and how was your methodology of doing it?
For this, we did not do anything with this. This is from the Healthy Communities Institute, and what we did was we provided $30,000, we being Gavilan College and Vision San Benito, for them to give us access into this. So there's a whole bunch of people, some were collecting this data with the sources, et cetera. I'm sorry? Universities, University of Berkeley, yeah, California. Berkeley is actually, Healthy Communities Institute is actually in Berkeley and utilizes a lot of Berkeley graduates. So they find the data, they put it on. We don't survey anyone with regards to that. With our own local data that we collected, that's when we went out and met with, we had our 18 community meetings. We talked to our core group, which consisted of 21 people from the community, planners, et cetera, et cetera. And then we also researched our data of 45 different sources that we obtained too. So
just kind of thinking off the wall here, and forgive me, my fellow board members, maybe if this probably enables us to qualify for more grants, right? If the report is too good.
By all means.
then we don't need
Then the
any
need is not there,
grants.
right. So if the,
Okay.
I mean, I hate to say it, but if the data is bad, the need, it shows that there's a need for, and what makes this, again, so wonderful is that it already tells us who's putting funds in that direction. So all we have to do is go in, if we see here, if we see in the red, that's already telling us that we stand a good chance for having a problem in our community. Then we go on that particular link, and it will tell us what are some of the promising practices, as well as who's going to provide us funding if we so choose to apply for it. So it's one-stop shopping for a grant writer, pretty much.
And I'm sorry,
Prostate.
and that's why I have issues with this adult tobacco issue.
But that was our...
Wait, let me finish. Because it came out that it looked like we didn't have a problem. And so it could be suspected, oh, we got to tweak those numbers because we're not going to be able to go after a grant for that. So now we tweak the numbers, and now we have a problem. I have an issue with that.
Right, right. And again, that data was collected locally. Let me see if I can find smoking data here.
I think the way we can explain it is that we have...
Will you come up to the podium, identify yourself?
Adults who smoke. Right here, adults who smoke. So let's see.
So I'm Lynn Mello. I'm the Director of Nursing at the Public Health Department. I just wanted to comment that I think the way we can look at it is here in our community, we conduct research on a small scale. And we did that with Dr. Garza, who's now gone, and a community core group, and people in the community in focus groups and surveys, and we came up with our own local data. Now we have other universities and the CDC in Georgia that collects information in many ways throughout the nation, and they do their research. And we come up with our local research, and they come up with more comprehensive research that's more university-based and driven. Does that make sense?
Definitely. There's always discrepancies depending on where you obtain your data from. Local data is going to be different because it's Lynn and me going out on the streets and trying to obtain this data. Whereas here, they said the smoking prevalence is 17.6%, and the information was gathered through UCLA. So we can go on that information, and we can go on that link and find out exactly how they obtained the data. And I could imagine it's going to be a lot different than just us going out and surveying our community members to find out how we got at it. So, and that's what's so great about this information is that you can compare it. You can see how well you're doing in your community. How do we get back? I have to go up here. So, okay. So was there anything else anyone wanted to look at in the community dashboard? I encourage everyone to go in and play around with it and see what you can find. Again, it's not just health indicators, it's socioeconomic, it's demographics related to our community as far as health qualities, et cetera, et cetera. So, and there's over 100 rankings, indicators there, so it's fascinating, truly fascinating. And then our next steps as this group is to continue to partner with our core planning group to develop more community health assessments, improvement plans, and come up with a strategic plan. Look and see where our problems are and how are we going to address them. We didn't know we had such a high prevalence of prostate cancer in our community. So we have to figure out, do we do local studies to actually determine, how we're going to, if it's a concern, and at that point, do we go into promising practices, et cetera, and apply for grants to address that? We also plan to develop and submit another grant proposal to the Health Trust for a second year of funding so that we can actually work on the strategic plan, because sort of all of us did this on our free time. And it's not part of our actual jobs that we were hired to do. So, but we're very excited about it. We want to see it come to fruition. We want to see some good strategic planning going on and some programs developed for San Benito County. So thank you for your interest in assuring conditions for healthier people in San Benito County. Are there any questions?
Are there any other questions from the board? Any questions or comments from the public?
And again, anyone can go on this website, the community dashboard. You don't need to have a login or anything. You just go right on it, pull it up.
Yeah.
You know, in your leisure tonight, instead of watching, you know, CSI or whatever, just go on and you know, find out how many people in this this county have prostate cancer. Fun times ahead. Huh? It's the the link, you mean, was right there, the community dashboard, that Bonito link. Go into bonitolink.com, and then the community dashboard will come up, and the link into it.
You owe for that. You owe for that advertisement.
I just, it's so simple, I just did it. I have it on my screen right now, so.
Good, thank you.
Yep.
Thank
If
you.
I could do it, anyone can.
Yeah, if you want to know voter turnout, you know, what female versus male, what community they're voting in, what community they're not voting in, et cetera, it's there. So, Christine, did you want to add anything? Yeah.
Good morning, everyone. Christina Chavez Wyatt, San Benito County resident. Chairman Munzer, members of the Board of Supervisors and staff. I was very proud on behalf of the Business Council of San Benito County to play a role on the core planning team and help to develop this initiative report. I also am working with the Community Foundation and the Public Health Department to help raise awareness about the release of the report as well as the launch of the dashboard. And you all had received an invitation to attend a celebration of the launch and another presentation on the report and findings, which is going to be next Friday, April 11th from 11:30 to 1:30 at San Juan Oaks. We're going to have a really nice big salad lunch bar, good presentation discussion. We're bringing the folks down from Berkeley to actually present the dashboard and a lot more of the intricacies in working and to answer questions more about the development of the data. And then following the lunch, if anyone's available, bring your shoes. We're going to go for a walk. Spend some more time together and get some fresh air. Again, that's next Friday, 11:30 to 1:30 at San Juan Oaks. If you have further questions, please let me know. I will send another invitation to you, sent to you on behalf of Robin Lynch from the Public Health Department. Thank you.
Thank you, Katrina. Anybody else from the public would like to comment on this item?
Okay. Well,
Seeing
thank you.
none? Thank you.
Thank you very much for your time. Thank you.
Okay. We'll move on to the next item.
Thank you, Mr. Chair. Yes, we're on item number 14. This is also coming out of our Health and Human Services Department. This is in regards to the introduction of ordinance to repeal and replace Ordinance 637, providing for regulation of ambulance and emergency medical services. So we have, again, Jim Riding Sword and Marcy Morrow to discuss this particular item.
Good morning again. This ordinance was an ordinance that you opened a couple of weeks ago. It's come back to you. We have received comments from Hazel Hawkins hospital staff. We reviewed those comments with County Council and felt that they were not necessary to the adoption of the ordinance. So today, we're asking that you make a motion to accept introduction of the ordinance, which is an ordinance amending Chapter 11.09 San Benito County Emergency Medical Services Ordinance of Title 11 of the San Benito County Code, that you waive further reading of the ordinance, and you continue this item to April the 15th at 9 a.m. for final adoption.
Are there any questions or comments of the board?
I have one comment, Mr. Chair. Hazel Hawkins Hospital was the one that requested, the organization that requested that we go ahead and meet, and they wanted to have some input.
Yes.
And I just want to point out that that did happen.
Yes.
And that, as I read through it, I wanted to know, well, why did we not incorporate some of those ideas? There were two primarily, but they were very well explained as to
Yes.
how and why they were not considered. I think the only thing that kind of led me to think a little further on this is that we provide the authority to approve policies and procedures to the licensed physician serving
Yes.
as the medical director. And I just wanted to know how that licensed physician is selected. I probably should know that, but I don't. Do you know how that physician that is the director of EMS?
That's a contract that we do with Dr. Benedict, and I think we've had that contract for a while, and he works with us on these issues.
Okay, and I think that's probably what I just want to get more information on, like when was the selection made?
Okay.
And because that's a lot of authority to approve policies and procedures, which I think is great, because
Yes.
you have a qualified licensed physician, they should be making those decisions. But it is also important for us to make sure that that contract is current and that we open it up for renewal if necessary. So
Let us research that and send the board some information on that.
yeah, and so that there's opportunity for a competitive
Yeah.
bid with references, and I mean, it's always good to, and we've talked about that as a board, that we need to look at our contracts, not just this one, but other contracts as well, that we make them more,
So I stand corrected. He's a part-time employee, not a contractor.
okay, so part-time employee of the county. So,
Yes.
okay. If you could give us a little more detail, that'd be great.
Dr. Benedict was hired in 1990. I believe there was a contract back then, but since has become a temporary employee through the EMS agency. He has been our medical director since the inception of advanced life support in San Benito County. And he also serves as the Santa Cruz County medical director. A lot of our policies are very much the same, so that when people come into our county in mutual aid, they're providing the same care that our local paramedics would be providing.
Okay, so does that mean then if we had an emergency that affected, as we have before, Santa Cruz County and San Benito County, that physician would have to deal with both counties at the same time?
Actually, he manages the EMS system, the policies and procedures. If there's a disaster, it really comes down to Joseph and myself managing that, and our public health officer for those disaster responses, and our CAO as the incident commander.
Okay, well, I needed to get information, because that was kind of raised a question on how, if it was a contract person, that we just needed to make sure that as a board, we go out and update this contract to make sure that we're getting served as we should be.
Absolutely. He is a temporary employee. He has a personal action form. He's under our medical malpractice and our workers' comp insurance.
All right, thank you.
Sure.
Mr. Chair, I think maybe the time has come for us to refocus that position and try to hire somebody within the San Benito County. Knowing that this position is a part-time, I think it's in the best interest of this community to look out in our community and see if there's someone out there that we can actually have members of the community submit an application and go through the transparent process in which the board makes a selection that actually resides in San Benito County. I would prefer to go in that direction than to continue the relationship that we have right now with the gentleman out of Santa Cruz.
Okay. Let us have a conversation with
Okay.
the CAO and Human Resources on that, and then we can report back to the board.
Fair enough.
And my comment is I was reading the AIT and I saw that the hospital made two comments or two recommended changes, and it was dismissed as not being relevant, and that was determined by this Dr. Benedict, who is not here today, and County Council, and I was a little miffed that those recommended changes were not even included in the AIT for us to determine whether they were relevant or not. And it left a bad taste in my mouth reading this over. So
We can send those to you and have them reconsidered on the 15th.
They were in the staff report.
They're in the staff report.
Well, whatever the desire of the board is.
Okay.
Let me open this up to the public. Is there anyone from the public that would like to make a comment on this? Or seeing none, I'll bring it back to the board. And what's the desires of the board?
Well, Mr. Chair, I'm ready to move on. As long as, I mean, I'll be honest, I'll be frank and honest with you. I think it's time for us to refocus that position and let you do the research. I would love to have somebody that lives in San Benito County, preferably, really. be transparent about how we select, why we select, and move forward. I'm okay with that, Mr. Chair.
Is that a
I
form of
talked-
a motion?
Well, yes, as motion, and I was just looking at it right now, so. Do we have to have a motion or just sit for the meeting? Oh, shoot, sorry about
Need a
that.
motion.
Let me go back to that, page 236. Okay. Well, Mr. Chair, make a motion that we read by title the ordinance of the record, the ordinance amending Chapter 11.09, San Benito County Emergency Medical Service Ordinance of Title 11 of San Benito County Code, and to make a motion to accept introductions, waive further readings of ordinance, and continue this matter to April 15, 2014 at 9 a.m. For adoption.
Second.
Any further questions?
Mr. Chair,
Mr. Espinoza?
if I may, I did meet with the CEO from Hazel Hawkins, Ken Underwood, and I asked him to review the ordinance, and he responded that nothing contained in this ordinance directly or indirectly involves hospital ED staff, oversight, or policy changes related to the local hospital ED, and they're satisfied with it. So I just wanted to make sure the board understood that as well.
Okay,
They're
thank you.
okay with this.
Okay, we have a motion and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. Thank you. We'll move on to the last item in the regular agenda. Mr. Espinoza?
Yeah, thank you, Mr. Chair. Yeah, we're on item number 15 this morning still. This is with regards to the RRP project. And we have Mandy Rose here to review with you the RFP in preparation of an RFP with your board with regards to the RRP project. So again, we have Mandy here.
Thank you. Good morning, Mr. Chair, members of the board. I'm here this morning to request direction from the board. If you'll recall, last time we did this, we had a great 7-year run, so maybe we can get this done a little bit quicker. As you're aware, we have some business interest in the Resource Recovery Park, but in order to even take any step in that direction, we do have to go through an RFP process. So again, I'm asking your direction if you want to initiate that process. I was asked to put this on the agenda by 2 board members, and so I'm looking for full board direction in that regard. And if so, did you want to participate in that, or did you want staff to put something together and bring it back to you and then maybe participate in the future, or how did you want to move forward on this item?
Mr. Chair, if I could?
Okay.
I was one of the board members that requested that we move on this, and because we've put a lot of effort, a lot of time, we approved it as a board to move forward with it, and I want to make sure that as we move forward, that we have a clear understanding of who's going to go there, and we also give the community an opportunity to have input on, we set the criteria, even though that criteria is really set on our ordinance.
In our ordinance.
We want to just completely reiterate that there are certain resource recovery companies or projects that we don't want there. So I think with that intent, I wanted to make sure that there was more participation from the board and participation from the community. So with that being said, I would support adding an ad hoc committee.
Before I make my comment, is there anybody else that? Okay, and I think we need to go through the process of developing a RFP. I'm not quite sure that I want to create an ad hoc subcommittee to do that. I think it needs to be done at the full board level. Things have been said that hasn't borne out. Unfortunately, I think we have a perception in the public of not being always upfront with them, and things get changed. I felt that at our last meeting when this project was approved. I felt something was changed that I had been told for 3 years was not going to happen. So I feel we need to go forward with for the RFP, but it needs to be done by the whole board in open session for transparency so the public can hear what's going on and they can feel comfortable with what's going on. Supervisor Botello?
Yeah, I'll support you, Mr. Chair, on that. You know, even though I think this entire process, I'm going to state for the record, has been completely transparent. There's been public hearings and questions have been answered in complete clarity. And I agree with you that that practice will continue. And I support that the information be conveyed to the entire board. I would be hesitant to have an ad hoc committee to consider some of these type of restrictions that we have in our staff report on the background information anyhow, because maybe you want a 100 by 100 building out there doing some certain type of business and maybe not another type of business. Maybe we don't want to see a munitions recycling, bomb recycling plant out there, but perhaps we want to recycle plastic. So I certainly would like to see the RFP go out and see what type of interest would come to the county. And we intend to continue our practice of being completely open with our information and public resources.
Supervisor Rivas?
Yeah, I want to see the process move forward as well, as rapidly as we possibly can. I think that there are some benefits to having an ad hoc committee. You know, I don't think transparency has anything to do with it or not. I mean, we had an ad hoc committee for the development of our oil and gas well ordinance. We had an ad hoc committee for the development of our consolidation of fire service, you know, and no one in those efforts questioned the transparency of that whole process. And so I think that there are some benefits to doing an ad hoc because, you know, I think it will allow the involvement from our board to get this process done rapidly, and then in the end, everything is reviewed by the full board anyhow. So, thanks, Mr. Chair.
Guess on the swing vote. I'll support the ad hoc committee. There's times where you definitely want to allow for healthy discussion to occur. I would support that, Mr. Chair.
All right. I will open it up to the public. Is there anybody member of the public to speak on this?
Shorty Silva, John Smith Road. My only concern here is there have been promises made to the public if you review your minutes of board meetings, planning commission meetings, and now we're going through a process where it is not in full disclosure before the full board. And I think before you do that, you need to look at what was said and what is in the minutes and what was promised to the public.
Thank you, Shorty. Okay, I guess then, is it the consensus of this board to form an ad hoc committee? Is that what I'm hearing?
That is what you're hearing, I believe, Mr. Chair. And at this time, I would like to make a motion that we prepare a request for proposal for the San Benito County Resource Recovery Park, and that you appoint an ad hoc subcommittee to work with staff or direct staff to prepare a draft document for full board review. And this is the part that's critical in my motion, that it be full board review. The recommendations from the ad hoc committee will be only recommendations, but it will be as transparent. And I felt that this was a way to be more transparent by making sure that what we have promised is in that, or goes out on that RFP. So, thank you, Mr. Chair. That's my motion.
Okay.
Should I?
Is there a second?
Second.
Okay. There's a motion and a second. All those in favor?
Aye.
Those opposed? No.
No.
And, okay, so it passes 3-2, and I will appoint Supervisor Botello and myself to the ad hoc committee. With that, I think do we want to go into closed session now, or do we want to have closed session after lunch?
So I think we can do the first closed session, would probably take about a half hour. And then the second one, we probably would want to do after lunch, although the board can see where we're at and make the decision at that time.
Okay.
I'm out of 12 at lunch.
Okay.
Okay.
That means we probably won't get to the second one then.
Okay, so do we want to go ahead and, do you want to adjourn? Do you need to, we just adjourned to closed session, right? If I can have the attention of the board? Okay, so we just adjourned to closed session, and I asked for any public comment before we do. Okay. Is there any public comment on the closed session items? Seeing none, we will adjourn to closed session. Thank you for everybody for coming.
So we're going to go, I got to report if we're going to go in now. Are you going to go in now or after lunch?
We'll go in now and do the first item.
All right, the Board of Supervisors will now adjourn into closed session to discuss agenda items number 16 and 17 on today's agenda. Agenda item number 16 is to confer with legal counsel regarding anticipated litigation and the significant exposure to litigation pursuant to Section 54956.9 in one case. Closed session is authorized by Section 54956.9 D2E1. Agenda item number 17 is to confer with legal counsel regarding anticipated litigation and the initiation of litigation pursuant to subdivision D4 of Section 54956.9 in one case. Thank you.
Excuse me, we'll meet after lunch, after closed session. Okay.